Now, if you want to do a snapshot of Nigeria health system right now, okay, you have the life expectancy of 54 years for men, 59 years for women. That's not too tidy. Now, and you look at all our figures, 114 children per infant per 1,000 births are dying. So we are number 2 after Sudan. So Sudan 115, we are 114. And you look at maternal deaths. But then if you ask, what are the things causing this death? Measles, malaria, malnutrition, the chest infection, birth problems. Simple things that you can really do and resolve. Okay, if you look at the maternal health, the same thing, high figure. We are in what we call a multi-dimensional poverty, not just related to health alone, education, housing, basic infrastructure, opportunities. So these are multi-dimensional poverty that also impact negatively on health. And at the end of the day, you want to find out, why are we having all these terrible figures? You look at the finance. Here we are. We're doing 5.1% of budget on health. Whereas, how many years ago, 2000, in Abuja, we sat down, we said, you guys, we're going to put 15% of our budget to health. But we have never reached it. But Cabo Verde is doing more than 15%. South Africa is doing more than 15%. We are still at 5.1%. In reality, in 2024, we had about 1.6 something trillion for health. It has increased, the budget, but it increased to 2.65 trillion in 2025. But in dollar value, it decreased. It decreased in dollar value. And most of the inputs into health system are dollar-based. Active pharmaceutical ingredients, this equipment, that equipment. So in reality, our health budget is not increasing. That's why I feel like we're not doing we're not even doing 15%. And interestingly, what becomes concerning is that critical aspect of those health budgets are being cut. You are cutting budget to National Primary Healthcare Development Agency, where we have 33,000 primary healthcare centers. Only about 7,000 of them are working. So we are not getting it. Then secondly, you are cutting, you've increased budget for immunization, but you are cutting that of family planning. Where Nigeria, an average woman is having how many children? 5, 6 children. And then you are now complaining that you are seeing a lot of, and our population in 2030 will be 236 million people. Ooh. So now you look at that dissonance, things that are not adding up. Now, if you could now come to human resources for health, you and I, you just mentioned the ACPA. In terms of numbers, how can you be looking for less than